Welcome to this moving and people handling awareness training for staff who. Before we start, please be aware that there is an information booklet on moving and people handling. Speak to any member of the Health and Safety Department for an electronic copy. If you have any medical conditions, you must inform the person you're working with or your line manager. Thank you. The course contents are basic principles of manual handling, principles of how to look after your back, some pictures of unsafe techniques, a little bit about responsibilities under the law, and then some equipment awareness, and then awareness of safer handling techniques, and awareness of how to use hoist and slings. When we think of moving and handling or manual handling, we immediately think of lifting things, pushing, pulling. But it's important to remember that it also includes supporting someone. So if you offer your hand or you put your arm around them, all these things come under the definition of manual handling. The spinal column forms the major part of the skeleton. The spine is made up of 33 bones called vertebrae, 24 of which are movable. This provides flexibility to the spine. Note that the back is not straight, it has three natural curves. Between each vertebrae is a disc which acts as a shock absorber. This cushions the forces which are transmitted up and down the column. Each disc consists of a tough outer layer of cartilage, elastic tissue surrounding a soft pulpy center. Think of it as a jelly baby. It's flexible, but with overuse, it will eventually become misshapen. And some people say this is called a slip disc. Technically, this is called a prolapse disc. It may take years before the so-called slip disc starts to touch the nervous system, and then you feel the pain. As the whole body's nervous system is in the back, where you get the pain will depend on which nerve is being touched. For example, sciatica means you have pain in your leg, but in reality the problem is in the back. A key objective of this training is to reduce the risk of slip disc or prolapse disc. This picture shows a normal disc on the left and a prolapse disc on the right. Once the bulge starts to touch the nerves, you feel pain. Think of your backbones and discs like a hamburger. If you only eat from one side, the patty starts to ease out at the opposite side. We always lift from the front, so one simple thing you can do is regularly do some backward stretches. This may help with trying to avoid slip discs. As we get older, the discs naturally become drier and dehydrated, so more prone to becoming misshapen. So one tip is to drink small amounts of water throughout the day and keep the disc hydrated. The human body is a good piece of engineering, and the back is designed for basic actions such as lifting, lowering, pushing, pulling, carrying. However, it's not ideal if someone is carrying out manual handling and it involves twisting, stretching, straining. These increase the risk of disc damage. Tip: avoid twisting when carrying a load. Move with your feet to turn. Shuffle, shuffle, shuffle. Acute injuries such as fractures, bruising, cuts, torn tendons, strains cause instant pain, which in some ways is a good thing because your body is letting you know something's not quite right and allows you to change your technique. Chronic injuries develop over a period of time, sometimes years, and the main problem is they don't cause pain until it's too late. For example, prolapse disc or slip disc, because you only feel the pain when the disc starts to touch the nerves, but it may have been damaged well before then. Being off work with a bad back is no fun. Apart from the pain, it affects the quality of your life as you are restricted by the pain. It also has an impact on your family, especially if you have young children. And of course, it may affect you financially, such as loss of earnings. It also has an impact on the service user. Service users get upset when they don't see their regular carers. To reduce the risk of injury, it's important to carry out some warm-up exercises. This increases the blood flow to your muscles. All exercises covered should be repeated 3 to 5 times. Sitting on a chair, push your arms back and at the same time stick your chest out. Hold for 5 seconds. Give yourself a hug, then gently rotate your upper body to the left. Hold for 5 seconds. Come back to the middle, rotate to the right, hold for 5 seconds. With your right hand, push your left shoulder down. Then move your head to the right. Hold for 5 seconds. Then swap hands and carry out the exercise in the opposite direction. This is a fun exercise. Sitting down, move your legs up and down as if jogging. Standing with your feet hip width apart, bend your upper body to the left and downwards. Repeat in the opposite direction. Now, standing up, either next to a wall or freestanding, put one leg in front of the other, lower the front knee and try to keep the back leg straight. Feel the stretch. Come back to the middle and change legs and repeat. Most people will be familiar with good manual handling technique. So the first thing is carry out a dynamic risk assessment. Can you lift the load? Which direction am I going? Do I need any help? Once you've established you can lift the load, start by having a stable base. One foot in front of the other, hip width apart and close to the load. Next, bend your knees and just before picking up the load, lift your head up. This locks the spine in a good position. Carry the load close to the center of your gravity. Think of this as the belly button. Elbows in and then walk. Remember, no twisting. Shuffle with your feet to change direction. This picture shows the safe zone. Basically, the closer the load to your center of gravity, the less pressure on your back. In the first picture, there is no stable base. However, in the second picture, one foot in front of the other shows a good stable base. Good manual handling comes with practice and lifestyle choices. So always use your thigh muscles to lift. This is done by bending the knees. Keep hydrated. Drink water throughout the day. This makes sure the discs don't get dehydrated. Do some warm-up exercises every day. And don't forget, regularly do some backward stretches. Never lift a service user from the joints. This is clearly an unstable position for both the carer and the service user. Use the minimal handling approach. In this case, use slide sheets. So rather than lifting or pushing or pulling, if equipment is available, use it. This technique is no longer allowed and is clearly a safeguarding issue as well. Please watch part